Hi, everyone. Thank you for joining us today for Pathways to Successful E-MDT Sustainability. I'm Marty Washington from NCall. I want to just take a moment to thank our grantors from the Office of Victims of Crime for sponsoring not only this webinar, but most of the work you do with your E-MDTs. So, and I also want to remind you that any of the thoughts, opinions, or comments you hear from this presentation are those of the author and don't necessarily reflect the views of the U.S. Department of Justice or the Office for Victims of Crime. Housekeeping, I think most of you have been here before, but those of you who have not, please, if you're not speaking, mute yourself to cut down on background noise. Rename your square so if we are conversing with you, we know who you are. Use the chat if you do have questions, and we'll keep an eye on that. And if you have any technical assistance problems, please reach out to me at mwashington@ncall.us. And with that, I'm going to welcome our speaker today, Tamara Fife. Tamara, take it away.
Thanks, Marty. Hello from the south end of the Salish Sea in Washington State. I'm currently on the Squaxin Island Reservation. It is sunny and about 68 and moving up to pretty hot for us. 68 is the high temp I like, and it's not even lunchtime yet, so it's pretty warm here. I'm grateful to be able to join you and to learn about your gifts and talents and experience and education in the work that you do. I'll share mine, and I look forward to you sharing yours. I recognize that each of you is the expert in your community for your E-MDT, for your mission. I'm a technical assistance resource. I'll share what I've seen, what I've done, what I've learned, and I hope that you'll share with me and each other so that we can benefit from the shared wisdom. But I always know you are the wisdom in this room, and I'm grateful for that. I'm just like a tour guide along the way. So welcome, and I'd like to get to know you. So we have an introduction slide. And because I'm essentially lazy, I'll be asking you to do most of the work today. But I'll give you some examples of work before I ask you to do it. So when you introduce yourself, I'm going to ask you to give a little elevator speech. I'll give you one for me, and then maybe you can take a minute and think about yours. An elevator speech with what your MDT does, what you accomplish, and maybe a call to action. So I would tell you, I'm Tamara. I'm a member of a nationwide training and technical assistance group, and we support capacity building activities for MDTs who work together, keeping our communities healthy and safe. And that would be my elevator speech. It's not really great with call to action, so I could work on that, but we'll work on them together today as we spend time going through this slide deck. So, Darlene, I see you're in the room with us. Would you like to start with an introduction? Can unmute yourself. Darlene disappeared, and I just saw Jill in her place.
Oh, no, I'm back. I'm back.
Oh, good. Oh, good.
I had to get my headphones. My dog is barking.
Okay.
I'm Darlene. I am actually employed by the Legal Aid Society of Northeastern New York as a paralegal. And in that role, I am the elder abuse multidisciplinary team coordinator for the Mohawk region here, which is Fulton, Montgomery, Hamilton, Warren, Washington, and Saratoga counties. And in that role and working with that team, my goal and the goal of all our teams is to really get the best outcome and recommendations and suggestions for the clients that we're working with. I hate the word victim. I do not want to use the word victim because everybody who comes to us is a survivor in one way or another. So victim is not in my vocabulary. I think that the whole purpose is really to do the best we can and to take the special areas of each of the team members and put them to use so that only they have to do what they do, and we can provide the additional services by the experts who do them. And in that way, alleviate a lot of extra work for each agency. So I believe that would be my elevator speech.
Thanks, Darlene. How about you, Stephanie?
Hi, I'm Stephanie Edwards. I am the E-MDT coordinator for the Peninsula Elder Abuse Forensic Center on the Virginia Peninsula, aka Yorktown, Virginia. And we hear complex cases of elder abuse, neglect, self-neglect, and financial exploitation. My grant specifically focuses on providing trauma-informed services to victims of financial exploitation. Sorry, Darlene, I'm using the word victim. Anyway, so that's what we've been doing the past 4 years on our grant. We provide counseling services, civil legal representation or advice rather, psychological capacity evaluations, and financial fraud education to older adults in the community.
Thanks, Stephanie. How about you, Jill?
Hi, everyone. I'm Jill Rutledge. I work for Lifespan of Greater Rochester, and my role there is I am a E-MDT statewide technical assistance advisor. So like you, Tamara, I am providing technical assistance and support. Well, not the technical IT, but assistance and support to all the amazing E-MDT coordinators in our state that do all the difficult work like Darlene was explaining. So my call to action would be to, always be on the lookout for gathering as much information as I possibly can so I can support all of the folks that I work with.
Thanks, Jill. Kimberly?
Oh, I'm not even muted. Kimberly Hunt, I am the E-MDT coordinator with Lifespan of Greater Rochester, and I do some Finger Lakes counties. What else? A lot of people have already said what we do. We take cases, we work with providers in the community that that bring the referrals to us, APS, Office for Aging, law enforcement, financial, and we work together as a team to come up with ideas, options, safety steps to help the older adult be able to move on.
Thanks, Kimberly. Norma? Can you unmute yourself, Norma? That's usually my party trick to start talking and leave myself on mute. I know after 5 years, I should be better at it, but I'm not.
So I'm Norma Watman. I'm an E-MDT coordinator in New York State. I work for Lifespan and I have 4 counties, and our teams review cases of elder abuse. I'm noticing that most of our cases recently are financial exploitation cases. And our goal is to, keeping what the victim wants, try to stop or, as we say, reduce the bleeding. So I think that's it.
Nice. Thanks, Norma. Angela's being a little distracted, so I'll just jump to, is it Angelica or is it pronounced differently?
Hi, yes, my name is Angelica. Nice to see you all. I'm a program coordinator with the Center for Elder Abuse Solutions at Weill Cornell Medicine. I facilitate the boroughs of Queens, Manhattan, and Staten Island, and we focus to support the workers that service our New York City older adults.
Thank you. Mariales?
Hi, everyone. Can you hear me?
We can see you too. Thank you.
So I am also a program coordinator at the Center for Elder Abuse Solutions. In my role, I facilitate collaboration amongst various organizations and agencies and disciplines throughout our work, and I do this via the E-MDTs, of course. I also provide case consultations to professionals who are handling these complex cases and are in need of additional resources or to build meaningful connections that might assist them in these cases. And yeah, I guess my call to action would be that if you're working, with a case that might have different victimizations or any type of elder abuse component, I welcome you to feel free to reach out to my team.
Thanks, Marianas. Is it Jamie or Jaime?
Hi, it is Jamie, but written as Jaime. Fun fact, my mom thought I was a boy until I came out, and so I'm named after my uncle. So, for all purposes, Jamie, but if we were back at my island, Jaime, they'd be like, wait, you're a girl, and then that starts a whole different conversation. But that is me. Thank you for having me. I'm excited to hear. I'm excited to be here. It's excited to learn from everyone. So I am the senior clinician for the Helpline for Concerned Persons at CEAS, Weill Cornell Medicine, and the senior program coordinator. What does that mean? What it really means is that I support my colleagues with the clinical work that we do and we see when we triage cases on the Helpline for Concerned Persons at our E-MDT level. I also facilitate the case consultations in all 5 boroughs for professionals and help my team delegate cases that we'll be sharing to the E-MDT, facilitate and coordinate the meetings. My call to action is, I think differently today. Usually it always changes, but today I call on one another to support each other in these times. I think our work is not only difficult work, but it becomes more difficult when systems are impacted and the people that we service are impacted, primarily vulnerable adults of color. And so my call to action is to stay safe within the work, let's lean on each other. Can we call on one another to tag each other in when we just can't anymore? Because what about us sometimes? So that's my call to action. I'm here to support you all during this time, and I'm looking forward to learning from all of you. Thanks for having me.
Jamie, I was right. The wisdom is in the room. You evoked a deep sigh of relief for me, knowing that I'm amongst people who hold each other up. Thank you for that. Kylin?
Hi, I am Kylan Lewis. I provide technical assistance to our OVC grantees. I'm a part of the National Elder Abuse MDT Training and Technical Assistance Center here at Weill Cornell Medicine. And as stated, I provide support to E-MDT coordinators across our nation. My call to action would be if you have questions or just have inquiries at all, we ask that you submit any of your technical assistance requests and reach out to your TA providers, as we are always here to support your work, no matter how small the question may be. We are here really to bounce ideas off of each other and really to provide any type of support that you may need as an E-MDT coordinator.
Thanks, Kylin. How about you, Grace?
Hello, everyone. I'm Grace Chung, Program Manager with the Center for Elder Abuse Solutions at Weill Cornell Medicine. I'm also the Program Manager for the National Elder Abuse Training Technical Assistance Center. I work closely with good folks like Marty and Kylin to provide consultation and support to coordinators that are present here and many that are not here, who are doing the good work of keeping elders safe in their communities. And our work primarily is to work in collaboration with them to understand their community needs, to figure out the players that they need to work with, and together keep elders safe across the country.
Thanks, Grace. Angela, I see you're back. If you've had a moment to catch your breath, do you want to introduce yourself?
Yes, so I'm Angela Bailey. I'm the MDT social worker coordinator here at Onslow County DSS in North Carolina. I lead a group of professionals to improve the lives of the mistreated and vulnerable adults. We try to help them get the community resources as they need in hopes before we have more of a CPS case. So I go out and recruit and try to get, as much resources as I can to help those who are already in care, but those who have not yet come into care.
All right, thanks. And Marty, you are the person that got me here. Is there anything you want to add to your introduction?
I work at the National Clearinghouse on Abuse in Later Life, work closely with Kylan and Grace. And I've got to say my call to action would be to always keep in mind that we are the experts of our own lives. And even though someone is older, doesn't mean they don't know what's best for them. So we want to always be victim-centered or person-centered. When we're working with individuals, let go towards what's important for them.
Thanks, Marty. Thanks all of you for sharing. I learned a little, and I also figured out how to connect with some of you a little bit. And so those are great introductions. When Marty asked me to come visit, I met Grace and Kylan about a year ago and talked about the topic of sustainability. It means so many different things. And so from the perspective where I've been working in victim services over the past couple of decades, my work has come to believe that sustainability is our shared capacity to create, collect, build, and maintain the resources that we need to keep us as part of the core infrastructure for our communities. EMDTs are part of the ways that we promote justice and we heal victims of crime. But what does it mean to sustain it, right? We have programs and services. We connect resources. We build relationships. And when we're successful and continue to do that work with or without funding, that work gets done in my experience, they call it sustainability. So over the years, I've worked with other folks to develop some tools for figuring out what our capacity is to be sustainable and what actions we can take to strengthen our capacity. And that's what I brought to share today. Tools that I brought to share, I think Marty probably mentioned, they're not published work. This is from my private collection. I came up through the domestic violence movement of the 80s and the 90s, and so we share everything freely. So I would just ask you to, as you always do, keep confidentiality where you know it needs to be kept, but plagiarize, honor through plagiarizing any of the work that I've done, because I was taught by others, as we all are. So Marty sent y'all some handouts, and I think what she sent was something we call a sustainability plan worksheet 1 or sustainability worksheet 1. It's a blank Word document, looks like a table. She sent you a copy of that same document, but completed. And that's the one we're going to work with for this first exercise. And then she also sent you a couple of completed, like example 2 and example 3 of sustainability worksheets that I've done with other groups. Trust me when I tell you, there is no right or wrong way to do this. This is a go with the flow, go with the group kind of activity. So I'm going to walk you through the first worksheet, and then we'll talk about it after each sort of scenario. Does that sound okay? And if you'd like, I sent you a blank one in a Word form so you could use it if you wanted to. But the one that we're going to work with, Sustainability Plan 1 completed, you can write on it. Like when we go through the scenario, if you want to highlight where you think you're hearing about capacity or seeing capacity built, feel free to, take notes on it, because like I said, we'll be talking about it. Okay. I'm sorry, I'm running my slides and Marty's supporting me by running slides, and I forgot to tell her to advance the slides. I skipped over the objectives because you got to put them in for the people who approve slide decks, but they help shape the material that I brought here. you as learning adults, experienced people will take away what's meaningful to you. And I hope in some of that meaning that you get things you can use about sustainability, different tools, building collaborative relationships, those kinds of things. Sorry about that, Marty. Got ahead of myself. I got too excited after meeting everyone. So then there's a sustainability slide, which is what was on my screen when I was talking about it. Sorry about that. And then there's the blank worksheet that you have. We'll talk about the worksheet. We can go back, Marty, just to I just would say bless your heart now. Thank you. So in this blank sustainability worksheet, it looks like a table. It is. On the top row, there are the columns are labeled personal, organizational, community, and political. But that left column is called a capacity indicator. Capacity indicators are relationships, skill building, interdependence, and commitment. So let's now we'll go to a scenario and we'll talk about how we identify capacities in our work. So my story for this one is a few years ago, our private nonprofit organization's mission was to keep victims of family violence safe. That meant at home, in the community, at school, in the court system, everywhere. We had a 3-year federal grant. It was funding and it provided court advocates. So when domestic violence victims were going to court to seek protection orders, the county prosecutor was really more focused on offender accountability and cared that during the process, survivors, people seeking those protection orders were not re-victimized. So they let us put 2 advocates in the courtroom. We tracked the data for our project about the success of the protection orders, and we shared that data with our MDT. And because having those court advocates resulted in stronger protection orders and less violation of protection orders, the MDT felt like it was worth continuing to provide court advocates in the hearings. And the prosecutor saw the benefit through the data because he was, show me the data kind of guy. So he actually put in his county budget funding for those 2 advocates when our grant ran out. So if we go to the sustainability sheet, let's do some reflections. When you hear this story, and you can unmute, you can raise your hand. I don't know how unruly you are as a group, so we'll figure that out. When you hear that story, where did you see capacity built? You can raise your hand, you can unmute, you can type in the chat box. I'll try to monitor it all. You're looking at if you look at the completed inventory, there should be some examples in there that you might be like, oh, it's one of these, or.
Am I on the slide you want me to be on, Tamara?
Yeah.
Okay.
So when the county prosecutor picks up the budget to keep advocates in his courtroom, where was capacity built?
I would have to say building relationships and
Yeah.
would be the big one.
Great. Cross-organizational. So in the organizational column, relationship building, there was capacity built there.
it might be political if,
Oh,
if, you know, he figured out ways to get it into the budget, so the budget would be political.
Right. Especially a county government, right? He was an elected official and he got it in a county government. That's kind of a big deal.
And I would add commitment because he was committed to the program and the plan.
Right? Yeah, those are all good. Let's do another one. All right, we'll go to the next slide. This was a tribal justice system sustainability project. And the court program manager, they had like a family drug court, I think it was called. The court program manager developed a cooperative relationship with behavioral health program providers. And the court program agreed to provide judicial training to the behavioral health program providers. In turn, the behavioral health program staff committed to providing training to the court program staff. So after their grant-funded project ended, they had developed a written cross-agency protocol for providing services to survivors when they were having a behavioral health crisis and interacting with the judicial system. So we'll go to the slide, the reflection slide. Again, looking at the indicators of relationships, skill building, interdependence, commitment, do you see in any of the columns where there was capacity built there?
I would say the cross training across disciplines and then the ability to be able to respond in on a in a multifaceted way across the areas of support.
Right. The commitment change in going from an informal to a formal response.
Mm-hmm.
That's certainly capacity for those of us who have written agreements that will go beyond the funding, right?
Yep.
This one was in this particular scenario, sometimes they would find themselves, the behavioral health folks would find themselves at odds or in conflict with the court system people because behavioral health people had priorities and the court system people had priorities. And then when the crisis happened, conflicting priorities would, complicate things. And I watched the behavioral health people learn to understand the court system process, building their own skills and knowledge about the court system, and the court system people doing the same thing. And that's probably one of the most ahas I've ever seen happen in a single day. It was literally mind-blowing how much their perspectives changed when they took time to get training, cross-training. So that was the way that they built capacity. I have one more. This was in Oregon. There were several domestic violence service providers working across the state with a entity called a batterers intervention program. And there wasn't a state standard for, they called them BIPs, because of course in our world we love an acronym. There wasn't a standard for how BIPs operated at the county level. The domestic violence service providers would, make a liaison for an advocate for the BIP to prevent re-victimization, but they weren't getting any funding for it. And so the domestic violence programs built an alliance and they educated state lawmakers about the safety issues for survivors and the need to have accountability in the BIPs. So then the state passed a law, and the alliance was so visible in their advocacy work for education that the Attorney General invited them to come to the table to promulgate the rules, to write the rules that would regulate the BIPs. And so the advocates who'd been funded as liaisons were no longer necessary because there was a formal regulation in place for those programs. So in the reflection slide, can you see where capacity was built at the different levels? Where do you think that the level of capacity was built that you could see? I'm not seeing any hands up. You can just unmute if you want to speak. Okay, what about in the indicators? Do you see any capacity building in the indicators from that scenario? Okay, Marty, we'll go to the next slide. This is a sustainability worksheet completed. And this one, I think, is from the second scenario. They show that at the personal level, individuals were building capacity to learn about the judicial system. They were learning skills to know how to interact with them, and they were strengthening opportunities to work together. That was the change, the capacity at the personal level. At the organizational level, they understood each other's roles better. They had knew how to communicate better through their data management system. At the community level, they had a new partner that they were actively collaborating with, as opposed to having conflict, and it felt supportive. Definitely there was new respect built from the activities that they did. And then they could talk about, what other partners they needed to bring into their work, if there was any rules or regulations or laws that they needed to address. They were working towards the same vision. Their call for action was a common one. And so when they completed this worksheet, they had their own data specific to their community, to their MDT, that they could mine for both writing goals and activities in a plan, but also for seeking additional partners. We'll talk about ways that they did that. Another way that a group used this kind of tool is they were a anti-human trafficking group, and they wanted to train hospitality workers how to recognize and report abuse of guests in their hotels. They had a really strong, through this exercise, they determined they had a really strong relationship with a state agency, but they didn't have an interdependent relationship with any connections to the hospitality workers. So they looked at their relationship with the state agency and talked about how they built it, how they maintain it, who that's with. And they went to that partner to talk to them about their new goal of training hospitality workers. And they actually figured out a way with that state agency partner to get worker training on the licensure requirements for those hospitality groups. So they were able to make political change using an existing recognized capacity and leveraging it to get further advance the sustainable part of their work. So this really is, this worksheet really is your own data. As I said, you'll see in the examples, when you look at them, example 2 and example 3, they're all very different, and The approach to them is very different, but how they use them is pretty much the same. It just becomes local data. So let's go on to the next slide and see what you guys are thinking about this. Where do you have a lot of capacity? What do you think about capacity in this context? Where do you want to build more capacity? You want me to go through the, I'm going to go through the list and you can say pass, or you can speak to anything on this slide or the scenarios. Kylan, I'll start with you.
Sure. I think as a TA provider, we have the most capacity by just being able to assist and provide support to those in need. And we also provide connection to our partners in the community. And just knowing who those people are and being able to connect them to the right person is a great way where we have, I guess, the most capacity.
Okay. Any place you see that you could build more capacity?
I think we can always connect with more individuals. I think every webinar and kind of anything I attend, whether it's a conference or a talk or a gathering, I try to build relationship. So that way I'm either familiar with a face or a name to be able to connect that individual with someone maybe in the future, or also to keep that person in mind when we're thinking of webinars and things we want to bring to our grantees. And so
Okay.
I think, ways in which I would like to build that is to just to continue that practice and to continue to go out and meet new people in the field.
Yeah. I know that's what you do. I love that's what you do. I'm also a connector, and I know the power of putting it in a plan and writing it down too. It has so much value when it becomes mineable data to be like, how big is your connection circle? So that's awesome. Grace?
I would say organizational capacity is the strongest with the National Center. Like we set out with very strong foundations around data management, around curriculum for training, and being able to kind of mine information about what's needed in with the communities that we work with, and over time just being able to see the community grow. So it kind of feeds from the organizational to the community. Where we can build more capacity, I imagine, is political. Like it feels in this current context when we're thinking about a bigger influence or being sustainable and being relevant with the changing context. It feels like there's a missing link there, and maybe those missing connections and interdependencies don't quite play out in the way we'd like to.
Interesting. I see head shaking along with you. Darlene, do you have anything that you'd like to contribute?
Couldn't get unmuted. I think that I have the most capacity probably in operational and community. I like to think of my teams as all one community because I have 7 counties, but I have 5 teams. So I like to think of us as a community working together. And then I think to build more capacity, I usually attend and table at all of my Office for the Aging and summer picnics for all of the teams that I coordinate in all of the counties. So usually what I do is I take my flyer and I take my business card and I go from table to table to table to table and I introduce myself and explain what it is I do and how what we do might be able to benefit the agency that I'm connecting with there. I've had a lot of luck with that, especially law enforcement agencies who table at picnics and things like that, because they don't always realize how helpful we can be, especially when they're looking at a criminal case with our forensic accounting portion, which is a great part of our grant that's offered at no cost to police agencies or district attorneys' offices. So I find that I have the best opportunity to get to know people in that very informal setting.
Darlene, I love your summer picnics. I wrote that down. I'm putting that in my basket. I'll trade
It's
you one for
great.
it. I ran into a group that does pop-up craft tents. And so they'll set up a little canopy in a parking lot and they'll have a little packet of craft and you can drive up and get a little packet of craft and get their spill while you're there to introduce to their service. So pop-up craft tents, I'm trading you for summer picnics.
And also because I work for legal aid, I'm like a fly on the wall of everything that legal aid offers. So I'm usually have all of the information about the other grants that we have and the other things that we can do to help people. We do foreclosures, we do evictions, we do domestic violence, we have income tax, we do LGBTQ rights. So even if it's not something directed for E-MDT, I can always give out information for another one of our grants that I think is always very helpful too.
Any place that you could think you'd want more capacity?
I think it depends by team, by county, because
Oh.
some teams, like I've worked in Fulton County where I live in one of my counties for my entire 40 plus year career in a variety of locations. I'm a retired probation officer, supervisor. I ran a DV program for 3 years and I've been doing this for 5. So I think that I have the best connection and best capacity with the people in this county because we have personal connection, previous connection. And I think that there are other counties where I'm building that with the trust and the knowledge that, we have worked so well together. Agencies will call me and ask me questions all the time, even if they're things that don't really apply to E-MDT, and I never refuse to talk to anybody, even if the person they're looking for help is like, in their 30s, 40s, or 50s, because I might know something that might be able to help them. So I think that that's the way I can build connection and capacity with any agency that I can actually connect with.
Nice. Thank you for sharing that.
Sure.
Stephanie, do you have anything that you would like to share? Oh, maybe Stephanie's not with us
It
anymore.
looks like he's hopped off.
Okay, that's fine. Jill, how about you? Anything you can share?
So I'm looking at the the different squares and thinking about what people have already said. I do think that the relationships are a key for us, and if I'm looking at the statewide initiative, I think we have a pretty large capacity to be able to connect with the nationwide folks and statewide folks and people in individual counties. I think one area, but looking at relationships, I do think like the one thing that anyone in E-MDT knows is that even if you have those relationships, they can change in a heartbeat because somebody retires or they change positions. So I think that's an area where we probably have to continually put energy in to continue to maintain those relationships. I'm thinking about the building skills. I think can be really important because like Darlene mentioned, when we have information and things that our community partners can use from us and need from us, when we have things that we can give them. So like we have forensic accounting, we have geriatric psychiatry, but we can also have things like if we go to enough webinars and we learn a whole lot about scams, or we know about support groups that are available for scams or things like that. That's information, and continually building our skills. It's information that we can give out to other folks. And then I think the interdependence and the commitment are areas where we can definitely build more capacity, because I think having our community partners come to the table is great, but we also want them to come to the table and stay. So sometimes it's like, yeah, we recognize this, but then if they're not bringing cases for us, or if they're not coming to meetings, they're listed as a team member, but they're not actually bringing cases and coming to meetings. we have to be able to show them that, we're dependent on them to come to the meetings and be part of the team. And, hopefully they would be dependent on us when they have cases in the community to, have our resources and work together in the ways that we can bring people together. So I guess that's what I would say.
Yes, thank you. Kimberly, can you share?
Piggybacking off what Jill just said, everybody's kind of already touched base on, but just agreeing, I know for me, the relationship building is something that's always ongoing because there are changes. People come and go, or maybe someone comes for just, one meeting. Um, I think that and um the building skills, the political piece, I think can get touchy sometimes. Or the relationships as well, anything political, actually. Because I think now you just have to be more careful than ever with how you say something. Because sometimes folks, specifically law enforcement, they get a little, you don't know my job, or I know what I'm talking about kind of thing, if I'm being honest. So that I think is something that is a struggle to work with. Mhm.
That's the day that we did the team retreat with the behavioral health folks and the court system folks. We also had law enforcement with us, and they were all wearing sidearms. And these are, they had had some pretty big conflicts. As a matter of fact, I think it was the judge of the family drug court that mandated them all to attend this retreat because they'd had a conflict that upset the judge. So as a facilitator, it was the first time I was like in a room where 1/3 of the people were wearing sidearms. It's like it brings a different flavor to the conversation. And still, because of the way they were able to interact, we were able to understand their roles and what the work is like from their perspective and priorities. And so it's man, there's a lot of trust to do that kind of work. And it's not easy, and you have to have we had to have a judge. We had to have a judge say like, "Oh, thou shall." So there you go. Let's see. Um, Norma, did you share?
I wanted to add something in regard to the political. Sometimes it's a wake-up call, or you have a team member who says, I need to tell you something about how the political system in our county works. And this is this is what happens in regard to our district attorney and what he's willing or not willing to do. And it impacts, it was like okay, I get it. And that district attorney is not part of our team. It's been invited, doesn't respond in any way to us. So anyway, I just wanted to comment on that. And also I sort of see sometimes the various teams ebb and flow on some of the indicators, like, sometimes you think things are really going well in this county, and then it's like, oh, but this other thing is popping up over here. So sometimes that's just how it is.
Yep, and you're the expert on your community. One of the district attorneys that I ended up having the most success with when he was first elected, he just wanted to do drug cases, and he didn't want to talk about victims of crime or domestic violence or any of those kinds of things. And he had a daughter the same age as my daughter, and she was in my Girl Scout troop. And I actually used that relationship to build relationship with him about what he wanted for the safety and wellness of his own daughter, to get that for the rest of the girls and women in the county. And so the relationship is, they're so key, and we'll talk a little bit more about those. But let's hear from Angelica. Did you have something you'd like to share?
Sure. I think for the EMDTs that I coordinate in the New York City boroughs, I think where we have the most capacity would be in community. It's nice to see in EMDT discussions, community partners step up and sort of just be willing to take the lead on some things, especially when we have complex cases as crazy as it can get in the New York City area. So it's nice to see that. I think where we could build more capacity is in like the personal category on the sheet. I think sometimes our community partners, they don't really understand what another agency does or what APS's criteria is, or they don't really have too much understanding as to where maybe they would be able to make more sound judgments when referring cases out and whatnot. So just having a better, more interpersonal understanding of each agency and what role they play and how they could help and what their limitations are with some things, going into the meeting in advance with that sort of knowledge definitely could maybe help engage the other professionals in the room and help conversation.
My plan writer brain wanted to start taking notes when you were talking. That was so clear and specific. I could see having a lot of success of building that capacity. Jamie, anything to share?
No, I think everyone pretty much summed it up because we mirror, our work is mirrored so much in our roles. But I think the only thing I will add on, just to echo the theme, is shared learning for professionals and providing, perhaps expanding capacity on skill building. And I think sometimes the hard thing is that sometimes they're thrown into this work, right? With either compassion or non-compassion, and they have to learn as they go along. But in the midst of learning is practicing, and the real work is happening. And I think sometimes there's skill sets that they feel comfortable with, and then that they don't feel comfortable with, and that plays a role in their ability to participate in the meeting or want to bring a meeting for discussion because they're intimidated at either the lack of knowledge in one area, or don't feel comfortable enough in specific methodologies of the work. For instance, I can see a new worker having extension, like providing an extension of training to professionals around engagement when we hear a client is not adhering or not, they don't want to work with us, or they just extending our foundation to provide more shared learning opportunities so that we can increase capacity at the meetings. A lot of times they just don't know how to engage in the meeting because they don't understand what they're lacking. And I think if we can somewhat provide a shared learning opportunity as an additional component, that can build a different type of capacity. That'd be the only thing I add.
Wow, that's powerful. You could change the agenda for your meeting to, monthly or quarterly include that. Ooh, I might take that one from you. That's pretty good.
Totally fine. Let's work together.
Oh, that's great. Marialas, anything to share?
I think that the nature of the work will kind of be very similar between our answers here, but I do want to say that um I'm gonna be fully transparent when saying sometimes it is a little rocky to maintain the partnership relationships. And I think that meeting them where they're at, they go through turnover, a lot of changes, things like that. That has been something where I think we can say we have the most capacity and can build more capacity at the same time, right? That's one of them things that might vary across organizations and how each partner decides to interact with the EMDT. So it can often change, but I think that um, just continuing to offer the support is key.
Thank you. Well, Angela, we're back to you. Are you available to share anything with us, or are you still getting pulled in a lot of directions there? Okay, she might be in another conversation. Marty, I kind of blew past you. Anything you want to add?
I heard over and over again the importance of relationships and building capacity. And I think that really speaks to how important it is. And I feel like that is something that my agency has a lot of capacity, not only developing relationships with staff, because there's only 5 of us, but we have this huge web of partners and consultants that we bring in, and together we have the capacity to address so many different issues. Where we could use some more work in building capacity, I think, is we have limited funding, and the funding streams are narrow. And I really think that we're going to be limited unless we can change that situation. And I think that's our biggest challenge regarding capacity.
Interesting. Thank you. Thank you all for sharing. I'm going to let that spin around for a little bit. We've been doing this for almost an hour, so we're going to need to take 5 minutes and get our circulation system working again. Let's take a quick break, 5 minutes. We'll come back at 2 minutes past the hour, and we'll talk about sustainability plans, go through 3 quick tools, and just keep going. So about a little break. 2 minutes after the hour, we'll come back. And it's 2 minutes after the hour. We're back. Hope you got a what I like to call a jump and a wiggle, maybe even a snack if you were quick. Marty, we can go to the next slide. And we'll come back together. We might need just a tiny bit more time. I just thought of an idea where we could have asked people to put their hands up when they left the room and put their hands down when they returned to the room. Next time, I know, next time. Okay, now folks are back. Thank you. On the slide on your screen, there are a couple of questions about a sustainability plan. I'll ask you to use the chat box to answer the first question. What's the stage of development for your plan? You're not sure you're going to have one? You're talking about it? You're kind of doing assessments? Or you already have a draft plan? Can you type in the chat box? What's the status of your E-MDT's sustainability plan? We're talking about it. Can you type in the chat box? Okay, thinking about it, talking about it. Okay. The second question is, if you're thinking about it or talking about it, what resources do you need to support development of your plan? Do you have some community strengths gaps data? Do you have any capacity data? Or to tell the honest truth, you need a paid plan project manager because your plate is already full. We're in the same work, aren't we? Our plates are already full. But I have, okay, you want some capacity data? Yeah. I've never seen any OBC grant funded entity get a paid plan project manager. I've seen some good planners like tribes have tribal planners, and I've seen them do some good work. But all the work I've ever seen done on a sustainability plan has happened at the MDT. And that's the truth. And they try to do it in a way that I guess they do everything working together. I'm going to show you some of the tools that I've seen them do to use that work. So feel free to ask questions, type in the chat box, pause. I think you have in your handout some copies of these tools. So you've had a chance to look at them. And if you have any questions, this would be great time to ask those. So the first tool is on the next slide, Marty. And this is it started with a tool that they used for safety planning. It started as a tool, a safety plan that domestic violence service provider used with their clients. They went through and identified every type of resource or service a survivor might need. And then they kind of morphed it into assessment by sitting together at a table with some good snacks, mind you. And they went through the list to make sure in their community, every kind of resource that a survivor or victim of crime might need was on the list. And then they said, do we have it? And if we have it, is it enough? Or do we need more of it? Or do we not have it? So I was thinking about that. They wrote a plan with just a few goals, 2 or 3 goals for specific services, and wrote some activities about how to build relationships to sort of get those services. And one of the barriers they had for clients was transportation. And the honest truth is they ended up getting a car dealer to donate a van to one of the service organizations to transport clients in crisis. It was amazing. And so it wasn't fancy and they didn't use any fancy tools. I'll show you the next one on the next slide. Here's a similar one. This was one we did in a tribal community. It was like a strengths needs. We started with a survey instrument from Texas Women's Hospital on what a community needs to keep women safe and healthy. So safety and wellness services. And then we sat down with a group of tribal elder women because only the members of the community know the community, right? So they took that Texas Women's Hospital survey and they edited it so that it was appropriate to their people, their culture, their politics, their geography, and their sovereignty. And then they sent out they sent the surveys, like paper copies, out with members of the MDT to no summer picnics, but that'll be on the list yet. They sent them to powwows and health fairs. And they have something called general council meetings where all enrolled tribal members show up. And softball tournaments, and every place that people would show up in a group, they sent people out with these surveys. And in Indian country, we like to have raffles. We're incentivized to survey like anybody, right? So the MDT provided some auntie-made beaded earrings and different things for raffle items. And so they incentivized, they had this display and people would put stickers on things, and it was pretty simple, pretty primitive, but they did it over and over and over until they had, for the first time, their own data in a desegregated way. The tribal people had never had their own data on these topics. And once they got their own data, the tribal council were able to prioritize which services they could support building aligned with their existing community plan. And then they filled the gaps with direct requests in federal grants. This is what we have. This is where we're going. This is the gap we're trying to fill. This is what they need from you. And it was so specific and it was so unique to them that they were very successful in their grant writing, in getting funds to fill those gaps. This is not fancy. And this required so little money, but it required a lot of relationships to get done. Let's see if there's another one. The next slide. This was a group of people at a tribal community who were working from the health field. They were public health people, really, fairly educated, and they were working out like how to do community assets inventory based on like the John Kretzman and John McKnight's work out of the 1980s and 90s on community asset-based community development. And so they were looking at the tribal community, looking at the strengths and the assets of the community. They were putting it on a socioeconomic logical model. And unfortunately, they didn't have influential tribal representatives doing the work with them, and it never got out of committee. And so this was not reviewed and approved by a council. It was a strong tool and they had a lot of strengths, but they didn't have the right people at the table. And so that's something that I learned from their work, and how this pops up from time to time and people will talk about it, but the community didn't birth it essentially. And so it can't grow there. And so it's so important to have of the community working on the plan for people being served in the community. Y'all know that. I know I know you're the choir here, so I'll move on. Lessons learned. Let's ask you, what do you think about this type of strengths needs assessment? Do you already have it, or are you working on it? Do you have capacity to do something like this? You can unmute, you can raise your hand, you can type in the chat box. What do you think about doing something like that?
I'm going to come off mute because I'm too lazy to type all this. We have an assessment tool right now to gauge what's going right, what's going wrong in a community, coordinated community system, where we look at system change versus like an E-MDT, where you're looking at particular cases. And I think one of the problems with it is it's so long to gather information on all the different aspects you want to gather. It's so long that people are intimidated by it and don't want to use it. So that's the drawback of it, even though we have it.
Interesting. Thanks, Marty. Other comments?
There's a comment in the chat. Kimberly says, I like the idea, but we still need to build capacity.
I agree as well. I don't think we have like a specific tool or assessment already established. That's something that would be in the talks. But I also wonder if my team would have the capacity at this point to start that, or maybe we can, future date it as well.
Okay. I have done this with, I don't know, 8 to 12 groups. Sometimes it's 2 people working for a specific program. Sometimes it's 12 people led by an influential leader on the MDT. It does take some capacity, and I would agree with that. But they do seem, with a little bit of coaching from the outside, they do seem to be able to get it done. And I'll show you. So once you have that capacity worksheet completed and some kind of an assessment done with your local data, you can put it in a plan. And there are all different kinds of resources for plans. I've seen people use different ones. I brought some to show you. So I'll go to the next slide, Marty. And Marty, early on when we talked, I think I gave you some links to resources, and hopefully those are accessible to folks with us on the webinar today. The Office of Adolescent Health has a sustainability guide, resource guide with a plan. Sustainability means different things to different people, like from the conversation where we started today. So again, you can take what works for you and make it work for you if you're working on a different definition of sustainability. But I liked some of their tools. I've seen them in some of the plans I've worked on. The next slide has a.
I just wanted to jump in here, Tamara, and say that I will be sending out the slides after the presentation today. So you will have all these links that are in the slides.
Okay, thanks, Marty. This one, I hope I sent it to you, Marty. It's from one of the best resources I have seen in years, but shortly after the election, it was taken down from the website, and I don't know why. It's a grant management toolkit from the National Human Trafficking training and technical assistance group. This is a treasure trove of resources, and they have some sustainability planning resources in this. I have it in a PDF form. So when I first saw it, I downloaded it onto my computer and then I would refer people to the link, but now the link's not up, but I can send Marty the hard copy if I didn't already. So there's information in this resource that you could use to help you. One of the plans that I worked on, pretty simple. It was from a human trafficking MDT, and some of their other work has been included in this presentation. They got really granular in their plan. It was realistic, especially based on the time and small amount of capacity that they had to do plan activities. It sort of got woven into their daily work activities, and they didn't have to write any grants to support their plan, but a lot of their activities blossomed into opportunities to develop unrestricted income, which was interesting. It was remarkably successful. It was all about relationships, and it was just done in every quarter, trying to get sort of a singular small activity done, but coming back together, reporting on their progress, like you said, holding each other up and be like, okay, now we can go for the next step, you know, and it was slow but sure progress on getting where they wanted to go on just 2 or 3 goals. It wasn't a big like big plan, but it was uh, really a persistent plan. And so one of the things I think about when we're working with plans in an MDT, you know, you say you got to come to the meeting, you got to bring cases. We do have to hold each other accountable. And so you're assigned an activity, you need to report back. We're going to ask you to report back, and we're going to give you a date to do that. So we're serious about it, and we understand things happen, and we can, you know, reschedule or be flexible, but we monitor. You monitor cases. If you're going to work on a plan together, you monitor the plan. And it's that monitoring that gives us the accountability for making sure that we, even if it's tiny steps, move each other forward. So now I want to show you kind of another set of tools. And do you feel like I'm really rushing? Because I feel like I'm really rushing, but you may not feel like I'm rushing. I may start to annoy you. We've been together so long. What do you think? We doing okay? Okay. So think of some stakeholders in your EMDT's sustainability. You can move to the next slide, Marty. Thanks. You're doing great as a producer today. I can't talk and look at slides and move slides and look at people's faces, so I appreciate you. All right, so you've got 2 or 3 stakeholders in mind. Let's talk about how you work with them. We'll go to the next slide. This, for me, years ago, was a huge aha, and I use it as a teaching tool very often. People will say, well, we collaborate with the Attorney General's office. We collaborate with the healthcare system. I'd ask you to assess your collaborations, because collaboration happens on a scale, and it depends upon whose vision or goal you're working on, as opposed to where you are on the scale. So when you're deeply collaborating, you have one vision that you all have to work together or you're never going to get there. It's synergy. 1 + 1 = 3. If you're not there yet and you're working on common goals, maybe you have written agreements. You scratch my back, I'll scratch yours, or you support this, I'll support that. There's cooperation before you get to coordination, and that is that we both agree that we'll do tables at the summer picnic. We're cooperating, we're showing up. You're talking about your organization, I'm talking about my organization, but we're cooperating in getting resources out to that community. And then there's just the communication. I know who you are, you know who I am, and that's kind of as far as we've gotten. The further to the right that you move on the scale, the deeper your collaboration is going to be. And it's okay and very realistic to have relationships with partners or stakeholders at every step. But if you're going to make meaningful, lasting change, you probably want to be really strategic about the collaboration. So with that in mind, any questions about this?
I have a question from previous slides around data management. Is this the right time to ask, or do you want to
The
go?
previous slide?
Yeah. One of the comments you had made about gathering information for the community needs assessment, how much data and what kind of data is enough for us to act? I think that's my question. And uh, in the New York City process, we do a taking stock at the end of the year each year. We ask team members what they think about the progress and who's a missing partner. And we'll get a lot of suggestions. And sometimes the question the reflection I have is around like whether this is just an anecdotal sense of like who's needed versus is this showing up in actual cases, or is this more a recency effect and stuff like that. So I think for me I struggle with where that balance is, because we do want to take their suggestions seriously, but it is also very effortful to move a certain way and not have kind of that backed by, I guess, reality in some ways.
Grace, if I had a door prize, I would give it to you now, the grand door prize, because that was the perfect segue question for the next slide.
Right.
Because everyone has that same thing. This worksheet started with 100 stakeholders on it. The MDT developed a coding scheme that you can see at the top. It's a check mark if they have a strong relationship, a diamond if the relationship could grow, a circle if it's missing, and X out if they just don't have time for it. So they went through their list, or the list that they created together, and they focused on the relationships to grow. That's where they started. They sort of thought, what could we do to grow these specific relationships, because they had an amount that was manageable for them. They wrote some activities into their sustainability plan. And then they, like the second year they were working on their plan, they're like, well, now we have the capacity to actually work on some missing relationships, which take a lot more investment and resources. So we'll work on those this year. And so they wrote some activities into year 2 of the plan. The great thing is that it's in writing, and the setting the goals, the targets for where to do the investment of relationship work were agreed upon. And then you could go through like, you said I go to meetings and I give people my cards and I introduce myself. And so you can look at this list together, agree that you're going to work on, these are the 10 we want to grow. Who knows them? Who has links? Who might run into them? And in the meantime, you have a written list of, eventually we're going to get to these, but you're still going to conferences and meetings and trainings, and you'll run into them. They're like, that's on our future list, but I'm just going to slip them a little business card now and say, I'd like to work with you sometime. I'll be in touch, or something like that. So putting it in writing with a prioritized system that's transparent and shareable is so valuable. It helps you manage the overwhelmingness of it. Like, yeah, but my day-to-day job never even gets done. How am I going to do this, right? So you go to a training, you sit next to me and we say, hey, Grace, what do you do? And you say, hey, Tamara, what do you do? I'm like to talk to you sometime, right? That's how it happens. And we made a little thread between us that we could grow. And people have used this to get gap funding. So they'll write to their funder and they'll be like, okay, we're at year 3 in our project, and we have firmed up this many strong relationships. To get to our mission, we need to have these 5 relationships grown. We'd like to get funding to do these activities to specifically grow these relationships as part of our sustainability plan. And they'll fund that. they actually funders I've seen like that. Okay, so now I'm going to show you one that a group worked on that had a different, they didn't use a coding system. They made a long list. It had about 50 on it. And they just took relationships to grow, relationships to build, and relationships to assess. And they put them on a timeline instead of the other way. They're just like, in the next 12 months, we're going to take every opportunity to meet someone, to talk to someone, to drop off a business card, to attend a meeting in these places. Who can go there? Who has any connection to this group? Put them on your schedule, report back when you get them done, we'll check them off. And so again, it's in writing, it's transparent, it's prioritized, and they were really successful with it. They may never, I don't think they ever got to the relationship to assess, because what happened is they had so much success when they invested strategically in the relationships to grow, that the rest became not important to them, because they could get where they were going through meaningful collaborations when they grew those very specific relationships. Okay, any questions about either of these relationship assessments that are part of a plan? Well, I promised Marty 90 minutes, but I feel like our energy is a little bit low and we're kind of running out of questions, or I've gone completely so fast that you're still at an earlier slide and you want us to go back. Does anybody want to go back?
Am I on the right slide right now?
Well, I don't see anyone asking us to talk more about them. So, let's go to the last slide and we'll see where that takes us, Marty. Yeah, this one. Okay. And on the slide, some questions. How confident you're feeling about contributing to the sustainability of your E-MDT? Is there anything that you can take away from what we looked at together today? We'll put those two questions up for now, and we'll close with the see if we've had any changes to our call to action. What's your confidence level? How about if you just do a hand raise? If you raise your hand if you feel confident. Zoom has a hand raise, right?
Yes.
Do you know how to get to it?
I am looking at.
Oh, I see
We
it.
have Angelica with her hand
Yep.
up.
Yep. I put my hand up. It was in more reactions, and then I had some choices there. Okay. Angela says she's getting more and more confident. All right. I'll go to the second question. You can unmute and just chat if you like. You can unmute or you can type in the chat. Anything that you are going to take away from today to share with your team?
I like the capacity table. I feel like it's something that would be really useful for the different teams. And, Jamie and I was just chatting during the break of like, oh, it would be really fun to do it as the end of the year activity for our teams and see where people land on just an acknowledgement of our strengths and where the gaps might be.
Acknowledgement of strengths. What a great activity, right? When I'm working with nonprofit boards, I pair that worksheet with a second worksheet on financial sustainability. And those two together is how they create their nonprofit sustainability plan. And so that's just one piece of another bit of work, but you're right. Looking at it, you can be like, wow. I've had people use it with funders where they're like, this is the capacity that we built with this 3 years of funding. We need 2 more years of capacity because you can see these gaps in capacity over here. We want to do some specific activities that we'd like you to fund. These are the activities. So it's it's data. It's data that you can use to support sustainability for mission progress, funding, attaining partners. Thanks, Grace. Anyone else? Okay, Kimberly's typed in the chat box. Thanks. Angela, Jamie, thank you. Okay, well, I'm gonna go through the list again and then see if anyone has a call to action in their elevator speech to support either sustainability or building collaboration. So on my list, Angela, you are first this time. Are you able to unmute and share with us?
I'm here. I'm not for sure exactly like my future elevator speech to
Okay.
support. I'm just, I don't know, we're trying to getting used to this. I mean, I come out of the CPS world trying to go into the APS and MDT position. So just trying to get it all together and figure it out is my biggest thing.
Okay, that's fair. We're all figuring out at some level, Angela, and that's the truth. We're all just figuring out at some level. Thank you for being here today. I can see you're
Thank
busy
you.
too. What a
I
valuable,
apologize.
no apology necessary. It's the real world. You're working in the real world. Mariales, anything you'd like to share?
I think that I'm gonna save my call to action for when I'm at conferences or where there's more people I can mingle with. And I'll let them know directly the services that we provide and the case consultations and how we can, assist them in their work.
Thank you. Jamie?
Echoing off of Mariellis, because we of course work together and our work mirrors. I think in my call to action is really holding space for professionals and really trying to understand maybe where they want to expand their learning, perhaps learning around topics that necessarily are coming up, trends that they see coming up at the meetings, and they're not afforded the opportunity to learn more about it at their agencies, trying to see how we can support them and bring that shared learning component to the meeting. So that would be my call of action, is really trying to meet them where they're at and assess what are the outside needs that coincide with the work we're doing together, and how can we support them in expanding their learning.
That's great. Thank you. Angelica?
Yeah, I really like how Jamie and Mariellis had worded it. I think my call to action would mirror that and also to just continue to support the professionals that we work with and just letting them know that we all have mutual respect and understanding of each other and our partnerships, and we all contribute different skills and knowledge and abilities, and we can all take away something from each other.
If you were trying to recruit someone onto an MDT and you used that as your elevator speech, I think you'd get them.
Thanks.
think
I'll keep that in mind.
that sounds respectful, and like every person that you have is valued. That was positive and strong.
Thank you.
Norma? I know someone left us, but I didn't think it was Norma. Maybe it was. All right.
It was Darlene that had to
Oh,
leave.
it's Darlene, yeah. Is Norma still here? I don't see her.
No,
Okay, we understand. Kimberly?
Kimberly hopped off too. She
Okay.
put it in the chat, sorry.
Okay. Jill?
I'm still here. Yep, I appreciate you sharing all of your tools, and I think my call to action would be, taking a closer look at them, sharing them with my fellow technical assistance providers, and I think we're starting to think a little bit more about sustainability as things are happening in the world. So definitely share it with them and kind of start having more of these discussions about how we can work on this moving forward.
Yeah, the shakier our funding gets, the more incentive there is to get something in writing that you can use to acquire what you're going to need to fill your gaps for sure, right?
Yep.
Yeah. Okay. Grace?
Um, I think the one thread that's like landing for me is that we are stronger together as a team, and older adults are safer because when we work better together. And so this idea of how we can work together and strengthen each other's abilities and lift up, what needs to be lifted up in terms of wellness and dignity of older adults.
I like it. Kylian?
Sure. I also like the suggestion that you gave earlier when I did my first elevator pitch, which was to write down, like plan. So to kind of add to it, to be able to write down a plan for connection, a plan for which community members would, I guess, be the best fit for different people that I'm working with. So to develop that plan moving forward.
Thank you. And Marty, I'm back to you where I started. You invited me here, kind of gave me some ideas about what to bring. I brought what I had, shared what I could, and is any thoughts you want to close with?
well, first I want to say, please don't jump off because I have 3 polls I need you all to fill out because talking about sustainability, they always want to know feedback. So please hang on for that. As far as my elevator speech here, it's important for us to understand that we don't want to ever assume that somebody else is dealing with it. And the best way to do that is collaboration. Let's collaborate together. Let's make sure that people are being supported by not making any assumptions.
Nice. Well, thanks for inviting me. Thanks for taking this valuable time out of your day to go through these things together. Thanks for the work that you do and for taking good care of yourself so that you can continue to do it. It's been a pleasure.
Thank you so much, Tamara. So I'm going to launch these 3 polls. It'll just take you 2 seconds to fill it out. It would really help us if you would. So here's the first one. Okay. Darn it. I'm going to do it. Here's the second poll. And now that I've figured it out, it should go faster. Here's the second one. Just a few more people. Only half have filled it out. Okay. And the last one. Okay. Thank you so much, everyone, for joining us today. Have a good rest of your day.
Thank you.
Thank you.